Hello, it's Clyde with O&P Podcast number 67. It is February 15th, 2019. I'm going to read from the O&P Almanac, October 2018. I'm a little behind, but what's my reading? On the happenings page, legal update, Congress reaches agreement on opioid legislation. The U.S. House of Representatives and Senate have reached an agreement on measures to address the opioid epidemic. Approximately 72,000 people died of drug-related overdoses in the United States between March 2017 and March 2018, according to the U.S. Centers for Disease Control, a 55.1% increase over the preceding year. Following the June passage of a bill in the House, the Senate passed the Opioid Crisis Response Act of 2018 in August, authored by Senator Lamar Alexander, Republican from Tennessee. The House and Senate announced on September 26 that both bodies had approved a 653-page compromise bill. Provisions in the final bill would require the U.S. Postal Service to take additional measures to prevent the flow of drugs illegally imported by mail, allow more nurses to prescribe medication for opioid addiction, and make it easier for Medicare recipients to access inpatient care for substance abuse, among other provisions. Members of Congress were awaiting a final vote as of publication. The White House praised the pending legislation as a whole-of-government approach to combating the opioid crisis and is expected that President Donald Trump will sign the bill into law, which he probably already did. The next in this happenings page, patient registration. National Repository will collect and store information on individuals with limb loss. The National Institutes of Health and the Department of Defense have partnered to develop a limb loss and preservation registry. Debuting in 2020, the registry is being designed to establish the number of people in the United States living with limb loss and provide insight on their challenges and needs. The goal is to collect data that will improve prevention, treatment, and rehabilitation efforts for the O&P patient population, according to NIH. The Limb Loss and Preservation Registry addresses a significant public health knowledge gap, said Allison Cernich, PhD, Director of the National Center for Medical Rehabilitation Research with NIH's Eunice Kennedy Shriver National Institute of Child Health and Human Development. The information housed in this database will be vital to preventing limb loss, improving the amputation surgeries, refining rehabilitation approaches, and guiding the development of devices for people with limb loss. NICHD has awarded a 5-year contract capped at $5 million to the Mayo Clinic to develop and launch the registry. Registry data will include electronic health records of U.S. adults and children. Researchers studying diseases and conditions that contribute to limb loss, such as vascular disease and diabetes, will have access to the registry, according to Cernich. Researchers will be able to sort the data by age, gender, and type of limb loss, according to NIH. DoD will be involved in development of the registry in an effort to improve the quality of care for active military personnel, veterans, and civilian members of the population. The joint effort between federal agencies allows us to collect data that will inform research and improve the lives of all citizens coping with limb loss, Cernich said. And that's the end of podcast number 67, and thanks for listening.